September 10, 2010. Can you remember what you were doing? Well, all 35 of your BSN graduates can. We were attending nursing school orientation, and let's just say that come Monday, on our first day of actual school, we had a few less students. In the last 21 months, we have gone through a lot, as most of you probably know, through countless tearful phone calls and thousands of dollars racked up on our credit cards spent at Starbucks, that you probably paid for. First and foremost, we would like to thank each and every one of you for all of your love and support during one of the most difficult, yet rewarding times of our lives. If you were to ask any one of us why we wanted to be a nurse, all of our answers will be different, but they share one common denominator, the desire to help those in need. We were fortunate enough to be taught by some of the best instructors around, and I'm sure my classmates would agree with me when I say their knowledge, patience, and most of all, their compassion and love towards their students have helped to shape us into the best nurses that we can be. We have learned so much in nursing school. For instance, the nursing process, which is a modified scientific method providing the framework for optimal patient care, known as ADPI. Assess, diagnose, plan, implement, and evaluate. Now, it's time for you to learn one of the basic, yet not so basic tasks of a nurse. Let us take your typical nursing student and apply the process. Assess. When you assess him or her, you see very dark circles under the eyes and very red and bloodshot eyes due to lack of sleep. An increase in weight, or decrease for those lucky few, due to an insane amount of stress and studying, requiring snacks and more snacks. And horrible posture, due to backpacks filled with way too many pounds of nursing books and all-nighters spent typing up those weekly dreaded care plans. Diagnose. Now here comes the fun part. So we use our advanced clinical judgment skills and assessment findings to come up with NANDA-approved nursing diagnoses, which stands for the North American Nursing Diagnosis Association. I'm sure you all knew what that stood for. I mean, I did before writing the speech. For example, a typical nursing student could fall under this nursing diagnosis as related to having a life outside of nursing school. Ineffective denial related to anxiety, lack of control of life situation, and overwhelming stress, as manifested by a student being a nursing student, enough said. Plan. This is where we come up with those knocks I'm sure you all have heard about, nursing outcome classifications. For this specific diagnosis, the student will have the following knock outcomes. Anxiety, self-control. Personal actions to eliminate or reduce feelings of apprehension, tension, or uneasiness from an unidentifiable source, or, in this case, nursing school. And don't worry, nursing faculty. I cited this paper using APA format. Now for the goal part using knock language. The student will acknowledge, recognize, and report significance of symptoms by graduation day, when it doesn't even matter anymore. Implement. This is where we get to use our evidence-based nursing skills that we have been practicing on each other, and let's be honest here, all of you at home, for the last 21 months. From our first bed baths on one another, complete with teeth brushing, our first night of injections, where some of us found out that needles can actually stay in the muscle if you forget to pull it out, and to our first NG tube insertions, where 4 brave souls volunteered their nerves for a good cause, and we discovered that it was normal for there to be a little blood and a lot of tears. For our typical nursing student, the following interventions using NIC language, nursing intervention classifications, could apply. Anxiety reduction, where all of you supported the use of appropriate defense mechanisms, caffeine. Calming techniques, the kind words we said when we discovered our 4.0 GPAs went out the door after receiving our first real nursing exam grade, where every multiple choice answer was indeed a correct answer, but we had to choose the best one. Counseling, offered for free on campus and where nursing students are regulars. And of course, emotional support, provided exclusively by most of you the week before a test, or more realistically, every day these last 21 months. Evaluate. This is where we see if all of our hard work paid off by assessing if our desired outcomes and goals were met. Look around you, we made it. Despite all the challenges and obstacles we may have faced, we are all sitting here today about to embark on one of the greatest journeys we will ever start on, being a registered nurse, after we pass NCLEX, of course. I am proud to stand here today, knowing that at least 35 future nurses will change the future of healthcare. I am proud to stand here today, knowing that at least 35 future nurses will never settle for complacency by continuing their personal education, because we know that providing the best care for our patients doesn't stop here. I am proud to stand here today, knowing that at least 35 future nurses will advocate for their patients, because they see him or her as as a member of their own family who deserves nothing but the best. Maya Angelou said, as a nurse, we have the opportunity to heal the heart, mind, soul, and body of our patients, their families, and ourselves. They may forget your name, but they will never forget how you made them feel. So, CSP Nursing Class of Spring 2012, let us help to heal our patients holistically and never forget how they made us feel, because they are the reason we are here today. Thank you.